I am Dr. Jeremiah Peck with Ally Academy Northwest, and welcome back to our video series to help you pass the NCE or National Counselor Exam. This video series has taken a deep dive into the 8 core content areas that make up the questions on the NCE, and in today's video, we're going to be looking at the core content area of assessment. Now, this video is not meant to be exhaustive over everything that entails an assessment, but instead to be a summary of core concepts that if you familiarize yourself with, you'll be able to cover the majority of the test questions and have a grasp of the understanding of the majority of test questions that have to do with assessment. Now, even the term tests or assessment, these are often used interchangeably, both in conversation as well as perhaps in some of your test questions. It's helpful to note generally a test is a product, while an assessment is the procedure or the application of that product. Two concepts that I'm going to be coming back to a few times that are going to be exceedingly important to be familiar with is the idea of validity and reliability. They're the two most critical factors in test selection. You always want to make sure ethically, by the way, that you are informing clients of the limitations of testing. One, clients are consenting as part of their informed consent to tests being administered or assessments being administered. But there are also going to be limitations what a test will and will not show, or what a test will and will not do, clinically speaking. Some questions can be administered through direct questions that you are asking the client. Sometimes it can be an observation basis or a client self-reporting and filling something out. There may be a variety, by the way, of common assessments that you are familiar with already. And these assessments may be cited in some of your test questions. They would include things like the ACEs test, the Adverse Childhood Experiences test, the PHQ-9, which is the Patient Health Questionnaire 9, the GAD-7, or the Columbia Suicide Severity Rating Scale, the CSSRS. Those are just some of the most common tests and ones that could actually be cited in some of your material and questions. There are different types of tests, ones that are, they fall into 3 categories. They are objective, subjective, and projective. Those are sort of the 3 types of tests that you will encounter. In terms of how tests are constructed, this is where some test takers, namely the NCE is a test, right? This is where you as an NCE test taker may experience some measure of anxiety. And I know a number of NCE test takers that I've coached to be successful have reported to me that they don't like math, they don't like statistics, they pursued a career in mental health counseling because they did not want to do anything to do with math. And here we are in navigating assessments, namely on the NCE, and it has a little bit to do with math and statistics. I don't want that to be a source of anxiety, fear, or a feeling of feeling overwhelmed for you. Instead, those feelings can actually contribute to a diminished ability to perform in this test. So I want to use some of these words, not to have, as I mentioned, an exhaustive grasp of all of these concepts by way of memorizing formulas, but instead that you're just familiar with these ideas as they relate to, again, the validity and reliability of a test. So some of these words and terms you're just going to see on a test, and it's going to alert you that this is in that category of assessments as it relates to test questions. One is a standard deviation. So this is on your standardized bell curve. You have your percentages which fall within that standardized bell curve, and a deviation is one or two measures from that average, right? So you have your average, which is the peak of that bell curve, and you can be one or two, standard deviations higher and one or two standard deviations lower. I'd encourage you to familiarize yourself with that bell curve and the percentages of those standardized or standard deviations, because that will likely come up on a number of these assessment questions. Generally, usually, depending on how your exam is proctored or facilitated, you have one sheet of scratch paper. I've encouraged folks to dedicate just a small corner of that scratch paper to drawing out a bell curve, writing down the percentages so they have a familiarity with those standard deviations, and that may be able to help them visualize some of the questions that they are asking. Reliability measures the consistency of a measure over time. Validity is the extent to which an experience can be generalized. So this is something where a test can be reliable, meaning it can be consistent over time, yet it can't be valid because it can't be generalized. It could also be the other way, where it can be generalized, but it changes to where a test can't be reliable. So we talk in tests about both reliability and validity as it relates to the effectiveness of the test. There are different types of validity that's important to be familiar with. One is face validity. That's the extent to which a test measures what it claims to. Think of this, a helpful way to remember this is, can you take the test at face value? Well, that comes from this idea that something has face validity. Does it do what it intends to do? Then there's content validity. Sometimes it can be a bit tricky. This is also referred to as rational validity or logical validity. This is the extent to which a test measures all aspects of a given topic. So someone who's experiencing a specific diagnosis, a content validity would say, here are all the different elements or aspects of that experience. Construct validity is how much a test can measure a theoretical construct. So if something is a theoretical experience, something that the client or the person that you're administering a test for is experiencing that falls within a theoretical domain, well, then there's tests and assessments that measure their experience according to that theoretical construct. So it's to say, taking the person's experience, translating it into terms that align with that theoretical construct and saying, according to this theory, this is what they're experiencing and to what degree. There's concurrent validity. This is how well a test compares to other instruments meant for the same purpose. So think of like a PHQ-9 and a BDI, the Beck Depression Inventory. There's predictive or empirical validity. This is a test's ability to predict future behavior or outcomes. These are tests when someone says this is empirically valid. These are tests that, based on someone's result, this future outcome is likely to happen. So they scored a certain way, and this is predictive of future behaviors, future outcomes, future actions, things of that nature. It's different than, say, a diagnostic test. And lastly, there's consequential validity. This looks at the social implications of using certain tests. So what are the implications or the consequence of that? There are a variety of applications of tests. Tests can be used to measure intelligence. We do see assessments used a great deal in academic settings, school settings, by way of standardization, used in K through 12 settings. If you're a school counselor, you likely have had more training than some of the clinical mental health folks with regards to K through 12 tests for children, including intellect, spectrum, things of that nature, behavior, and ADHD. And tests can also serve as a way of measuring a checklist of symptoms. Some tests simply ask clients to report on the various symptoms they're experiencing, and that serves as a form of an assessment as well. Sometimes assessments can assist in diagnosis. That is another form and function of tests, is that the clinician would use a test in order to further justify a diagnosis and in turn justify a treatment plan. Another use of tests, which would be really important to note in your exam questions, is you might be asked how to support a diagnosis in your treatment plan or how to measure something in your treatment plan. And the reality is that assessments, when you can establish a base, that is to say you performed an assessment at the onset and you can perform another assessment after an intervention has been implemented, is that gives you what's called a pre and post assessment or a pre and post test in order to measure in some way the effectiveness of that specific intervention. There are some ethical considerations to tests and assessments, which I want to summarize here briefly before the conclusion of this video, and that is tests have to be reasonable for both the client's presenting problem, they have to be reasonable for the client's cultural presentation, and tests also have to be reasonable based on the client's developmental stage, their age. The test has to have been standardized to that specific client. So oftentimes when selecting tests will say this test is for ages 7 to 12 or 18 plus, and it's ethical to consider the population that the test was designed for in the selection of tests. Also, in the reporting of test outcomes, tests often come with manuals which delineate specifically what the test was assessing for and what it was not assessing for. A clinician is to stay within the bounds of one, only testing and assessing based on their scope of competence, but two, not interpreting assessment scores outside of the intended interpretations as put forth by the authors, designers, or manual of that specific test. So again, this is sort of an overview of some of these statistical concepts, some of the terms that are exceedingly helpful for you to be familiar with. This is a section of the NCE that, because more questions come from the test and assessment section that perhaps many people would be expecting. About 20 questions, or about 13% of the graded questions, can come from the assessment portion. So I'd also recommend spending a great deal of time studying this section and the concept we've discussed. Thank you for watching today's video on assessments as part of the NCE, and I look forward to seeing you in the next video.